1, 2, 3, 4.
There are times I wonder if I'm really alone. There are times I wonder if I'm true. There are times when I feel alone and I'm full roam. There are times I feel alone with you. You are enough of you. And there's always a love for you.
I feel like my experience with the medical industry has been almost a literal roller coaster. I understand what the word literal means. It hasn't actually been a roller coaster, but it's been the highest highs and the lowest lows. At its best, there was a time when I was in a medical situation where I basically had a team of people that were working with me, and they were responsive and effective. They said, we're so excited to provide care to you. We've never had a trans patient before. We want to make sure that we're doing right by you. Can you recommend someone we can hire to train us to make sure we're giving you the best care possible? And I was like, am I living in a dream? And everything that happened in that process, they were just excellent. And they never made me feel like I had done something wrong to end up in this situation just by being trans. And that was great. And it was also not great, because now I have that to compare it to.
So every time you go to Planned Parenthood, you get to fill out this form. And on the form, it asks for the sex you were assigned at birth, your gender, and your pronouns. The first time I got to write in they, them, I was pretty stoked, but it took about 4 different visits, 4 different times writing in they, them, for it to finally get on the record and for them to start realizing. And they still haven't fully realized yet.
I never really knew how hard it was going to be to start transitioning, like how many steps there are and how crazy that is, that there are so many steps. I feel like it's just the medical community tries to be the gatekeepers to our transition, I think to prevent people from doing it, which is weird. I didn't start transitioning until I was 24, so a lot of people thought I was super weird for doing that late in my life.
I've had great experiences, and unfortunately people haven't. And I think recognizing that people that work in the healthcare industry and in the medical field, they're not trying to be malicious. Not all the time. There are folks that are, but sometimes they're overworked.
I feel like when you go in to get any sort of thing done, my favorite thing is when they ask if you're pregnant, and I'm like, no. And they're like, well, what do you mean? I'm like, well, I'm gay.
Anybody that can have babies, they have to ask that question because there's so many complications. But the people in the healthcare industry, they're not trying to intentionally hurt you or harm you by asking you triggering questions. Like, if you still have your uterus and your ovaries and your cervix, you as a trans person have to go and get specific healthcare needs.
My top surgeon was amazing. He was probably one of the kindest surgeon doctors I've ever met. He made sure to never mess up my pronouns, and my identification was not changed yet, and sent me emails every week after I got my top surgery for months, checking on me and asking me how my life was going.
HRT, my experience with it, I was a little scared, but I knew that it was something that I wanted to do.
For those of you that don't know, it's called Hormone Replacement Therapy. So 7 months ago, I started hormones, and my body doesn't like medication at all. So the first 3 days on T, I was vomiting a lot. It's really unfortunate.
HRT changed me a lot physically, and it made it to where now when I look in a mirror, I finally recognize that person. It doesn't feel like a stranger anymore, when I see that person. But I think a significant portion of it is how it affected me in terms of my mental health. I finally started being a person whenever I started hormones. HRT saved my life. HRT enabled me to finally function as an adult, and it just has done a lot for me.
I thought a lot about testosterone. as of now, I don't think it's something I'll do. There are aspects of the therapy that I would like, but there's a lot of stuff that I wouldn't want.
I guess like the most painful parts of HRT are kind of over for me now. It was like really hard in the beginning, dealing with never having acne before and all of a sudden having like a ton of acne and like bloating. I like had a really like big baby face for like about a year, which is like really embarrassing.
I took hormones illegally for 2 years, starting when I was about 20. I did not want to go to a doctor. I was scared of going to a doctor. I didn't want to have to go to a therapist and prove to them that I was trans. Then I realized it's actually not all that hard. And I found a free clinic, so whatever. I was able to actually see a doctor. And then I took hormones in various forms for 10 years. And I stopped last year to start trying to have a baby.
My experience with gender affirming surgeries, I've only had top surgery. My surgeon was really cool. Luckily, my parents were really supportive and they really didn't want me binding anymore because I tore a really large muscle in my chest wall and it was causing me insane amounts of pain.
I haven't had any yet. I am scheduled to have top surgery in 2 weeks. I'm nervous about surgery.
I haven't had any surgery so far, but I just got my letter for top surgery last week. And so this next week, my doctor will be putting in the referral to the plastic surgeon. And apparently it just happens so seamlessly here. So that's that. And then, so within a year, definitely I should have top surgery.
Never wanted any. Think my body's awesome. Even when my work was like, oh, we'll cover that now. I'm like, nope.
I'm probably getting my histo before the end of this year, and I don't really know if I want to get lower surgery. I feel like trans people are totally pressured into getting lower surgery because they're like saying that their bodies won't be seen as like whole. I think that's like bullshit. I think that people should just like love other people's bodies no matter what. And if you're gonna be worried about being with someone that's not gonna respect your body, then maybe you shouldn't be dating that person.
There are times I wonder if I'm really alone. There are times I wonder if I'm true. There are times when I feel alone in a full room. There are times I feel alone with you.
Sometimes I wonder if I'm real or if I'm seen.
I see everything you are enough for me. You are enough for you.
Thanks for tuning in to Roaming Gender. To get involved or find out more about this project, visit www.roaminggender.com.